New research shows 10% of adults who get COVID will continue to have symptoms for months. KENS 5's Jeremy Baker shows us what you need to know as another surge is underway.
Many people don't understand that even if you get COVID and are asymptomatic, long COVID could still appear much later and catch you by surprise.
Which can take a lot of different forms. It can be anything from trouble breathing, your heart suddenly beating rapidly, that brain fog we talk about.
We are also hearing kids have a lower chance of coming down with long COVID. In a study published in JAMA Pediatrics, scientists analyzed data from over 1,000 children around 10 years old in Alberta, Canada, between August 2020 and March 2021. Symptoms were reported every 2 weeks for 76 weeks. They said kids were considered to have long COVID if they had one of the following three: a positive PCR test for COVID-19, new symptoms that started at least 3 months after a positive test, and the symptoms lasted 8 weeks or longer.
It can be weeks by some definitions. Some studies are using months. There's not, as far as I know, a settled definition yet.
Some of the most common long COVID symptoms in kids are a sore throat, with 2/3 having that, 62% a stuffy nose, about half have a long-term headache, 42% a cough and fever, and about 1/3 say they are constantly tired. But what if you take a COVID test many days after your symptoms disappear and it's still positive?
We still recommend masking for a total of 10 days. But we do not recommend retesting yourself to be cleared for the general public.
Dr. Wu also says getting a vaccine likely lowers your chance of getting long COVID too. Jeremy Baker, KENS 5.